all of you. Today is World Mental Health Day, a topic which is very close to my heart as a doctor, as a psychotherapist, and as a childbirth educator. This topic is very important to me, especially looking at the current pandemic, because I know there are so many expecting mothers out there who are facing so many issues. Two pink lines when you see on your pregnancy strip, वो बहुत सारे इमोशंस आपके मन में लाती है. एक पल में बहुत सारी खुशी होती है, एक पल में थोड़ी चिंता होती है. क्या होगा, कैसे होगा, क्या मैं सही से उठ रही हूँ, क्या मैं सही से बैठ रही हूँ, क्या मैं जो कर रही हूँ वो सही है या नहीं मेरे आने वाले बच्चे के लिए. इतने सारे सवाल, इतनी सारी क्यूरियोसिटी, इतनी सारी एक्साइटमेंट, इतनी सारी हैप्पीनेस, ये एक कंप्लीट पैकेज है मदरहुड का. राइट फ्रॉम द टाइम आपको पता चलता है कि एक नन्ही सी जान आपके अंदर जन्म ले रही है, उग रही है, तब आपको ऐसा लगता है दैट मैं दुनिया की बेस्ट पॉसिबल चीज उसके लिए करूं. बट अगेन हमने सुना है प्रेगनेंसी ये एक रोलर कोस्टर होता है इमोशंस का. कुछ समय ऐसा होता है जब हमको बहुत अच्छा लगता है, कुछ समय ऐसा लगता है जब हमको बहुत अच्छा नहीं लगता है. दैट मे बी बिकॉज ऑफ द हार्मोनल चेंजेस जो हमारी बॉडी में हो रहे हैं. हमारे अंदर बहुत सारी डिफरेंट फिजिकल, मेंटल, इमोशनल चेंजेस हो रहे होते हैं इस टाइम पे. दिस इज वन मेन रीजन why the mental health of expecting mothers is affected. Looking at the current conditions and the pandemic going on, mental health of mothers is highly compromised. इसीलिए मैंने और प्रेगान्यूज ने ये सोचा कि क्यों ना इस वर्ल्ड मेंटल हेल्थ डे हम ऐसा कुछ करें ताकि होने वाली मदर्स के लिए हम एक डिफरेंस क्रिएट कर सकें, हम एक पॉजिटिव एनवायरनमेंट ला सकें उनके लिए, और हम एक चेंज अपने तरीके से क्रिएट कर सके फॉर देम. सो आई वाज सो हैप्पी टू सी दैट देयर वर सो मेनी क्वेरीज, बिकॉज ये क्वेरीज आप खुल के अगर हम किसी से बात करते हैं या पूछते हैं तो इनके सॉल्यूशंस लाए जा सकते हैं, इनको फेस किया जा सकता है. सो लेट्स टेक अप सम क्वेरीज जो हमारे कमेंट सेक्शन में आए थे. सबसे इम्पोर्टेंट क्वेरी विच केम अक्रॉस was regarding कि हमारा एंशियस होना या हमारा सैड एंड डिप्रेस्ड फील होना, क्या ये डिप्रेशन के सिम्टम्स हैं या नहीं. प्रीनेटल डिप्रेशन यानी कि जब आप प्रेग्नेंट हैं उस समय का जो डिप्रेशन है, इसको बहुत जल्दी से डायग्नोस नहीं किया जा सकता क्योंकि इनमें से कुछ सिम्टम्स तो ऑलरेडी पार्ट एंड पार्सल ऑफ प्रेगनेंसी होते हैं, जिसको हम फेमसली प्रेगनेंसी ब्लूज कहते हैं. Now, what are pregnancy blues? Pregnancy blues are the times when at times the expecting mother gets very emotional. मदर को ऐसा समझ में नहीं आता कि क्यों उसको रोना आ रहा है, क्यों वो जरूरत से ज्यादा भावुक फील हो रहे हैं, क्यों छोटी छोटी बातें उनको बुरी लग रही है, या क्यों कभी वो इरिटेट हो रही है. उन्हें बिल्कुल समझ में नहीं आता, और नहीं समझ में आने के कारण उनकी चिंता और बढ़ जाती है दैट दिस इज नॉट मी. मैं तो ऐसी नहीं थी, मैं तो बहुत खुश रहती थी, मैं बहुत मजे में रहती थी. अचानक से क्या हो गया कि प्रेगनेंसी रहने के बाद मुझे ये फील होने लग गया. शायद उस टाइम पे आपके जो हार्मोन्स हैं वो आपके साथ थोड़ा खेलते हैं, उसी के कारण आपको ऐसा लगता है दैट एट टाइम्स बिकॉज ऑफ द हाई लेवल्स ऑफ ईस्ट्रोजन एंड प्रोजेस्टेरोन यू माइट फील सैड, यू माइट नॉट अंडरस्टैंड दैट यू आर नॉट एंजॉयिंग, राइट. So nonetheless these are part and parcel of pregnancy. पर अगर ये symptoms आप 2 या 3 हफ्ते तक के रोज फील करें एंड दिन में बहुत सारी बार फील करें तो then it is a sign of depression. That is the major difference between pregnancy blues and depression. Nonetheless आपको ये डायग्नोस अगर खुद से आप नहीं कर पा रहे हैं, आपके आसपास वाले आपके बिहेवियर में चेंजेस नोटिस कर रहे हैं. The main signs and symptoms of prenatal depression यानी कि प्रेगनेंसी के दरमियान अगर आपको डिप्रेशन है तो है ज़रूरत से ज़्यादा आपको रोना आना, एक सैड मूड होना, कॉन्स्टेंटली आप बहुत दुखी फील कर रहे हो, आपको अधिक गुस्सा आना, आपको नींद नहीं आना या नींद पूरी नहीं होना, या जितना भी टाइम है आपका मन नहीं लगता है, एनर्जी लेवल आपका बहुत कम हो जाता है, भूख नहीं लगना एंड कोई भी चीज़ में मज़ा नहीं आना. अगर आप इनमें से कुछ भी फेस कर रहे हैं तो प्लीज 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 टॉक टू योर लव्ड वंस. आपके घर पे आपके जो आपके पार्टनर हैं, फैमिली मेंबर्स हैं, आप उनसे डिस्कस करें, उनसे बात करें दैट दीज आर द थिंग्स विच आई एम फीलिंग एंड विच इज नॉट फीलिंग राइट. आपको समझ में आएगा कि कुछ तो है जो मेरे साथ सही नहीं हो रहा है. So at that time, talk to your symptoms, talk to what you are feeling with your partner or your family members. Consult a doctor. Because कई बार ऐसा होता है कि हम सोचते हैं कि ये तो पार्ट एंड पार्सल है प्रेगनेंसी का. कभी कभी रोना या फिर एट टाइम्स वो एक्सपेक्टेशंस आपकी होती है प्रेगनेंसी के टाइम पे, जो अगर पूरी नहीं हो तो आपको इरिटेट होता है, या यू स्टार्ट फीलिंग लो, यू क्रेव फॉर मोर अटेंशन, मोर लव, जो शायद पॉसिबल नहीं हो. तो उस टाइम पे आपको ऐसा लगता है शायद ये पार्ट एंड पार्सल ही है. माई प्रेगनेंसी हॉर्मोन्स आर प्लेइंग. नॉट रियली. At least take an opinion. Take an opinion from your doctor. Consult your doctor. Talk to your loved one about whatever is going in your mind. And then जो कुछ भी है उसका solution लाया जा सकता है. The best part is that whatever it is, it can be solved. I'll just look into a few questions जो हमारे comment section में आए थे. The first one was definitely how to differentiate between whether it is prenatal depression or not. There was one question which was from Chandrayani Maji. She said that my sister is concerned about her visits due to the pandemic and this is leading to depression. What could be done? Pregnancy में the best part is that जब आपको बहुत सारी anxieties, बहुत सारी curiosities होती है, अगर आप अपना एक lifestyle create करें तो all this can be kept at a bay. What should be the ideal pregnancy lifestyle जिसके कारण आपकी चिंता, आपकी जो worries है उसको आप happiness में कैसे convert कर सकते हैं? I always say a very nice axiom that is प्यारी pregnancy, wherein P stands for your prenatal vitamins जो आपको regularly लेना है. Y stands for yoga because I believe that prenatal yoga not only balances your body but it also balances your mind. It gives a very calming and a relaxing effect to you. A stands for acceptance. Acceptance of whatever is coming your way. Pregnancy एक roller coaster होता है of emotions. अगर आप accept कर लें that this is how I should go with the flow. With the current pandemic, हमारे में सबसे बड़ी problem ये है कि हम इसको accept नहीं कर पा रहे. हमको ये new normal अच्छा नहीं लग रहा है. But nonetheless, this is inevitable. इसका अभी सोल्यूशन नहीं है तो माइट एज वेल ग्रेशियसली इसको एक्सेप्ट करें. काफ़ी लोग उनके बॉडी में होने वाले चेंजेस भी एक्सेप्ट नहीं कर पाते. फॉर एग्जाम्पल वेट गेन, दे फील दैट आई नो लॉन्गर लुक ब्यूटिफुल, आई नो लॉन्गर हैव दैट काइंड ऑफ कॉन्फिडेंस इन मी, आई एम नॉट दैट अट्रैक्टिव एनी मोर, अब कोई मुझ पर ध्यान नहीं दे रहा है. बट द मोमेंट यू एक्सेप्ट योर ग्रोइंग बॉडी, you will fall in love with it. The problem is acceptance. So accept graciously whatever is coming your way. R stands for reading. Pyari, P-Y-A-R. R stands for reading. Reading good books, reading positive thoughts to your baby, reading aloud to your child in the womb is one practice which is very close to my heart, as I have authored a book on talking to your baby. The book is called Knock Knock Let's Talk, wherein an expecting mother talks to the baby in the womb. हर हफ्ते माँ अपने होने वाले बच्चे से एक नई क्वालिटी सिखाती है, एक नई क्वालिटी उनको समझाती है और कहती है कि दिस इज हाउ इट शुड बी. इसके दो फायदे होते हैं. हम जब किसी से कुछ डिस्कस करते हैं या समझाते हैं तो उसका इम्पैक्ट हमारे पे भी होता है. इफ आई एम टॉकिंग पॉजिटिवली अलाउड टू माई बेबी, then that same thing would create an impact on me as a person. मेरी भी वो हैबिट हो जाएगी. If I say my baby that I have to be healthy, fit and fine, my baby you have to grow healthy, fit and fine. That is what those vibes will come to me as well. This is what the book is. And knock knock let's talk. Talk to your baby. Have this womb conversations. This is the best time for you as a mother. Make the most of it. I always call this as a blueprint phase. आप जैसा अपने बेबी को सिखाएंगे आपका बेबी वैसा ही होगा या होगी. दिस इज द बेस्ट फीलिंग. एंड जब वो बेबी आपकी बातों पे रिएक्शंस देगा या देगी, यू फील दैट द वर्ल्ड, दिस इज इट, दिस इज व्हाट हैप्पीनेस इज ऑल अबाउट. And I stands for you. You as a person. If you are a second time mom, as a woman, we play so many roles. We are a wife to somebody, we are a mother to somebody, we are a sister to somebody, a daughter-in-law, a daughter. But in context of pleasing all these roles, we often forget ourselves. अगर हम ये खुद के लिए प्यारी pregnancy, if we follow this for ourselves, for our betterment, and if we start taking care of our own selves, start loving ourselves for what we are, then none of these mental issues will ever come to you, right? So these are some things that you can nurture and develop in yourself, so that आपको ये जो pandemic के कारण होने वाली curiosity है, anxiety है, वो नहीं होगी, because you are making the most of it. You're not wasting your time thinking on things that are not important. I understand कि हमको anxiety होती है कि डॉक्टर क्या चेकअप के लिए जाना है तो कैसे जाएं. These days doctors have become very friendly. वो आपको video consultation भी देते हैं. If needed, once a month you have to go to your doctor, and if you're following all the sanitization, if you're following all the protocols, then I don't think it is a problem. Just don't overthink. Just try and go with the flow and try and make the most of it. Then there is no looking back. Then there was a question of Vaishali Sharma. She said, a friend of mine is going through the same. How to curb this? While I talked about pyari pregnancy, there are three things which I always stress. That is ahar, achar and vichar. Okay. Ahar is you have to eat well. As a mother, it is very important to eat the right kind of food. Obviously, हमारी pregnancy cravings होती हैं, उसे हमको pacify definitely करना चाहिए. But a healthy eating habit is very, very essential for a mother, because you will get all your nutrition, all your vitamins, all the things that you need, that the baby needs to grow, as well as that you will need once you deliver the baby, because your reserves are also compromised post-delivery. So all these things are, balanced if you really eat well. Then which are positive thoughts. Positive thoughts are so very important. Read onto the affirmations, talk onto the affirmations, read things that make you happy, and every day write something for your baby. Writing to the baby and talking to the baby is one thing that will always keep you on a happy high. There will be times जब आपको नहीं अच्छा लग रहा है, तब बात करके अपना मन हल्का कीजिए, because बात करने से ही बात बनती है. आपके मन में जो भी विचार आ रहे हैं, आप जो भी फील करते हैं, feel free to express it to your partner. Feel free to express it to somebody you really love and where you feel that you will be understood. Because once you shed off all your negative emotions and all your negative thoughts, there's just space for positivity and happiness. Make happiness a way of life. Your happiness should not be, dependent on something. It should be just a way of life, and just the way, you should actually feel. It should be a constant state. कई बार मैं पूछती हूँ कि what makes you happy? Someone will say that I feel very happy when I am with my child. Someone will say that I feel very happy when I've achieved something in my workplace. Someone will say that I'm very happy when I'm able to do something for my parents. I say that make happiness a constant thing. जब आप ये सारी चीजें कर सकते हैं, it will add on to your happiness. But your primary thing should be that happiness is my state of mind. So this is one thing. अगर आप अपना positive mindset set रखते हैं, तो nothing is going to affect you. And vyayam, exercise. Exercise is something which I stress during pregnancy, because it not only makes your body supple, but it makes it ready for birth as well. 40 minutes of exercise helps in secretion of endorphins, जो आपको दिन भर के लिए de-stress कर देते हैं. आप notice करेंगे कि exercise के बाद, instead of feeling tired, you feel all the more charged up, you feel all the more happy, you feel all the more, energetic for the entire day. So if you're following these protocols, I think pregnancy will not only become a very happy-go-lucky, but a very soulful and a very transitioning experience for you. Next question is from Kirti Kumari. She says, I'm 8 months pregnant. My BP is 150/80. My doctor has advised some BP tablets. Is it safe? I will always say that for all your medical conditions, you have to trust your doctor. अगर आपके डॉक्टर ने आपको कुछ रेकमेंड किया है तो he or she was with you for the 7 months of your pregnancy and उन्होंने कहा है that means it is good for you, it is safe for you and it is recommended for you. So always trust your doctor because that is very, very important. Next question is from Sangeeta Singh. I want to conceive, especially since 5-6 months I have gone into depression. Now, depression is a very clinical term and it is a very broad term. Like I discussed, depression को हम कैसे define करते हैं? There are some symptoms जो आप अगर more than 2 weeks रोज face कर रहे हैं and दिन में कई बार face कर रहे हैं, then it is termed as depression. For example, crying, irritability, having a sad mood, having low energy, having vague aches and pains, lack of sleep, आपकी एपेटाइट कम होना, these are some of the symptoms of depression. अगर आप इनमें से 4 and more symptoms रेगुलरली रोजाना 2 हफ्ते से ज़्यादा फेस कर रहे हैं तो उसको डिप्रेशन टर्म किया जा सकता है. The next thing is to know whether the depression is mild, moderate and severe and depending on its variety उसकी treatments आती हैं. The first mode of treatment which I usually recommend for mild and moderate depression is psychotherapy and counseling wherein you can talk and heal. Just open up your heart, just see what are the areas, what are your triggers, what is actually making you upset and what is the best way to cope with depression. And then you can, obviously there are other modes of treatment like homeopathy, allopathy. Depending on what is the severity, depression can be treated. And once depression is treated, make certain lifestyle changes so that your mind state is settled and then think of conceiving. Because whenever you are conceiving, आपका mind state बहुत ज़्यादा positive, बहुत ज़्यादा happy and बहुत अच्छा इसीलिए होना चाहिए because the mind state is imprinted on the baby to come. Right? The next question is from Reema Vani. उनकी USG reports are showing fetal activity नहीं आई है. From Reema Vani, she's saying that there are some problems in her USG. I need to know your last date of period to guide you more. Nonetheless, अगर fetal activity delay है, we need to understand what is the cause of it, whether the fetus has grown or not. क्या उसमें कार्डियक एक्टिविटी आई है या नहीं आई है, उसके लिए हमको लास्ट डेट ऑफ पीरियड पता होना ज़्यादा इम्पॉर्टेंट है. तो हम एक्सेस कर सकते हैं whether this pregnancy is going correct or not. Nonetheless, don't worry and the best thing is stay positive, stay calm and that will help you deal with whatever is coming next. Okay. Nazia ji कहती हैं she has a small fibroid with endometriosis and a left bulky ovary. With endometriosis, conceiving is a little difficult. IVF is one solution which we recommend to the mothers who are having endometriosis and consult a good gynec who can help you with your medical condition and then help you conceive. Then there is a question from Suneri Suner. Ma'am, this is my first pregnancy. I'm very tensed. Like I said, Suneri, make the most of this time. First pregnancy is one experience जो आपके साथ लाइफ लॉन्ग रहेगा क्योंकि हर छोटी चीज आप एज अ मदर ऑब्जर्व करोगे. When did the baby first kick? आपको कौन से टेस्ट अच्छे लग रहे हैं, कौन सी चीजों से आपको बहुत खुशी मिल रही है. These are some things जो फर्स्ट प्रेगनेंसी की बहुत अच्छे से याद रहती हैं. सो मेक दिस वन ऑफ द मोस्ट ब्यूटिफुल एक्सपीरियंसेस एंड सोलफुल एक्सपीरियंसेस. इसको बहुत अच्छा बनाने के लिए आप अपने बेबी से बातें करिए, नई नई चीज़ें जो आपको अच्छी लग रही हैं आप खुद का मतलब यू कैन राइट डाउन डेली टू योर बेबी, परफॉर्म गुड प्री नेटल एक्सरसाइजेस सो दैट आपकी हेल्थ थ्रू आउट प्रेगनेंसी अच्छी रहे. योगा करिए, मेडिटेशन करिए बिकॉज मेडिटेशन हेल्प्स इन रिलैक्सिंग योर माइंड, calming your mind. गर्भ संस्कार, वी आर ब्लेस्ड टू बी बॉर्न इन इंडिया बिकॉज गर्भ संस्कार इज समथिंग जो हम सालों से सिंस एजेस सुनते आए हैं. This is your blueprint phase. आप जैसा चाहे वैसा आपका बेबी हो सकता है. So just make the most of it. You know, talking to the baby, teaching good qualities, writing down, eating well, sleeping well, doing your exercises, yoga, meditation, and nurturing a hobby, and start loving yourself. Because once you do these things, you are sending such positive vibes to the baby in the womb, and that is very, very important as a mother. So all the best. And instead of getting anxious, and instead of being overwhelmed with the current condition, think that this is the best time of my life and I'm going to make the most of it. All the very best. Pallavi Agrawal, can crying affect the baby? That's a very important question, क्योंकि it happens that you are feeling so heavy, आपको बहुत रोना आ रहा है, and suddenly कोई बड़ा आके बोलता है रो मत, बच्चा रोता हुआ ही पैदा होगा. I mean, like, what? That happens with mothers, and that is one query which comes to me so very often, that if I am crying, will my baby come up crying only? While crying sometimes, is normal in pregnancy, but crying a lot obviously affects the baby. Not in the way that आपका बच्चा रोता हुआ ही रहेगा या उसका स्वभाव रोने वाला ही होगा, not that ways. But then when you're crying, when you're stressed, when you're anxious, there are some stress hormones which are released into your body. ये stress hormones के कारण आपके प्लासेंटा एंड आपके बेबी के बीच में जो लेन देन होती है of vitamins, of the nutrition which the baby should get for growing up, वो affect हो जाता है, जिसके कारण baby's growth gets affected. So that is one reason हमको कहा जाता है कि you should be happy, because when you're happy you are releasing hormones like oxytocin, which keep you healthy and which are good for the betterment of the baby as well. But when you are stressed, when you're anxious, when you're crying, when you're not feeling good, there are certain hormones secreted in your body which disturb the absorption of nutrients जो आपके बेबी के ग्रोथ के लिए अच्छा है. And ऐसा पाया जाता है कि जो mothers बहुत anxious, stressed and who have spent a lot of time feeling low, उनके बच्चों को आगे जाके थोड़े बहुत emotional problems होते हैं. So if you are not feeling good about something, feel free to talk about it. If you are not feeling good about, कुछ ऐसा है जो आपके मन को बहुत heavy feel करा रहा है and you want to discuss it out, then share it with your loved ones. Talk to your doctor. Talk to someone who understands you. Express it. उसको मन में मत रखिए, उसको मन में घर करने नहीं दीजिए, so that कई बार होता है that you don't express and it keeps on piling on and then there is an emotional outburst. So वो emotional outburst की स्थिति ना आए, इसके लिए जब जो लगता है, जब जो feel कर रहे हैं, feel free to talk about it to the people who care for you, who are for you always. So crying वैसे affect नहीं करता है, but if it is done for a very long time and if it is your state of mind, then definitely उसके effects होते हैं baby पे. प्रेरक शर्मा जी पूछते हैं, stepping out of the house, financial crisis, ये दोनों problems हैं. ऐसी कोई चीज है which can become a solution for both. I understand that stepping out of the house is bringing lots and lots of anxiety to you. Video consultation is one thing which we spoke about, that you can consult your doctor on a video call and understand that whatever it is जो है बराबर है कि नहीं, सारे parameters बराबर है कि नहीं, and once in a month you can go for your regular checkups. For the financial crisis, I would suggest that think on the saving angle. Save well for your baby. Have a very good financial planning. Plan your finances so that they don't, worry you much. I think planning is the best thing when it comes to finances, because if you've saved and if you spend wisely, then you are not affected with a financial crisis. Saving and planning is very, very important, right? Then there is a question from Himadri. Hi, my friend is expecting. I think she's going through PND. Will this impact the child? PND is the clinical diagnosis, that is prenatal depression. प्रीनेटल डिप्रेशन अगर वो क्लिनिकली वेरीफाइड है, मतलब अगर द सिम्टम्स आर देयर फॉर मोर देन 2 weeks, ऑल द सिम्टम्स विच आई सेड अर्लियर एज वेल, जैसे कि क्राइंग है, इरिटेशन है, फीलिंग सैड, कॉन्स्टेंटली अ लो मूड, sleeplessness, lack of appetite, all these things are there, then definitely it might affect the baby, because whenever you are sad, whenever you are worried, whenever you are anxious, whenever you are not feeling good, the hormones which are secreted into your body help, they cause the deficient absorption of nutrients for the child who is growing in the womb. So that is one reason that, prenatal depression should be catered and treated as well. Because अगर आप depressed हैं, आप सही से नहीं खा रहे हैं, तो जो nutrition आपको and आपके baby को मिलना चाहिए, वो दोनों ही नहीं मिल रहा है. If you're not sleeping well, then obviously the hormones which keep you happy, which keep you high, will not be secreted, because and the growth hormone which is secreted at night, agar wo sahi se secrete nahi ho raha hai, then obviously the baby's growth would be affected. So if your friend is suffering from PND, then my request is that talk about it to your consultant, seek help. Psychotherapy helps beautifully recover PND, and medication if needed, because agar bahut zyada severe symptoms hai, then medication is needed. Homeopathy again helps beautifully. Lifestyle changes are very important, wherein the family members are helping the expecting mother to come out of whatever she is feeling. The role and support of the loved ones and family members is very, very important during this phase. So get it diagnosed and get it treated ASAP, because once you are out of this, you'll enjoy this beautiful phase of pregnancy and motherhood. जो मदर्स को प्रीनेटल डिप्रेशन होता है, दे आर मोर प्रोन टू पोस्ट नेटल डिप्रेशन एज वेल, बिकॉज उनके उसमें वो बहुत जल्दी ट्रिगर हो जाता है. इसीलिए प्रेगनेंसी के दरमियान आपका माइंड स्टेट अच्छा रखना बहुत बहुत ज़रूरी इसीलिए होता है. सो यू हैव टू वर्क अप, you have to keep a very positive mind state, and you have to work up towards it, so that आगे जाके आपको post natal depression ना face करना पड़े. So please make sure that you're taking care of things. Next question is from Shraddha ji. She asked that if the mother is COVID positive, then can she breastfeed the baby? Now, there are two chain of thoughts when it comes to breastfeeding and COVID positive mothers. World Health Organization says that you can breastfeed your baby because there is no evidence of coronavirus transmitting through the breast milk. However, coronavirus does spread through touch. So उस समय हमको क्या करना है? What is the best thing that can be done? Before taking your child for feeding and nursing, you have to clean your breast and your nipple and areola very nicely in a very hygienic way, जो हमको समझाया गया है sanitation protocol. You have to clean the breast for 1 minute thoroughly, and you have to wear a double mask. You have to wear your gloves, because when you're taking the baby, you're directly touching the baby. So आपको उनको before feeding you have to wear your gloves, you have to wear your double mask, and post feeding, pre-feeding and post feeding, you have to clean the area very, very, very nicely. Sanitization is must. It should be thoroughly done. सबसे बड़ा डर मदर्स को ये होता है कि what if I give COVID to my child when I am touching? So there are some people who say that it is okay if you don't breastfeed as well, because 14 days के बाद आप relactate कर सकते हैं with the help of your consultant and lactation specialist. Just try and understand that what is working best for your psyche. If you feel that giving your baby the first feeds that are very, very important, if that can be done and if it is possible, then do breastfeed your baby, because there is no evidence as such that coronavirus getting transmitted to babies through breastfeeding. So breastfeeding is very much recommended, and immediately after the breastfeed, make sure that the baby is kept at a distance of at least 9 to 10 feet apart, where you can see the baby, where you can, I can completely understand what a mother goes through when the mother is not able to hug, kiss, and all those things would be definitely there. But nonetheless, when you're telling mothers and when you're talking about it, अगर आप मदर को ये काउंसल करें that this is for the betterment of the child, then वो मदर कभी भी ऐसा नहीं सोचेगी कि I'm not able to kiss my baby, I'm not able to hug my baby, I'm not able to take my baby. This is for the betterment of child, and this is just a matter of few days. Once you are out of your quarantine period, once you are out of this, don't worry, your baby is all yours and you can shower all your love on your baby. So don't worry if you are COVID positive, then also nothing to worry about it. There's nothing that can't be managed, right? Anushka Boy, she asks, do prenatal vitamins help in depression? Vitamin B6, folic acid. Folate is one vitamin जो usually expecting mothers को दिया जाता है. And there are many studies which say that जिन लोगों में depression पाया जाता है उनमें vitamin B6, folic acid कम मात्रा में देखा गया है. So इसीलिए usually when the mother is expecting, उनको folic acid start कर दिया जाता है because it has a dual advantage. It not only helps in the brain development of the baby, but at the same time it helps the mother and makes her less prone towards depression. There is also vitamin D, which is very, very important because deficiency and insufficiency of vitamin D is one of the causes of depression. So if you are taking vitamins, if you are taking your nutrition and vitamins properly, prenatal vitamins properly, then you are less prone to depression. The next question is from Shreya Das. Why is it difficult to recognize or admit to being depressed or anxious during pregnancy? Recognition, I understand that बहुत ज़्यादा difficult होता है. उसका सबसे बड़ा reason ये है कि कई बार when you are crying or when you're not feeling so good, you feel this is just a mood swing. And mood swings तो pregnancy में बहुत normal होते हैं. मेरी so and so को हुआ था. My friend also had this kind of mood swings. And even if you're sharing with your partner might say that this is because of pregnancy. Pregnancy में women बहुत touchy हो जाती हैं. That is one thing which is very well known in our society. उसके कारण diagnosis इसीलिए difficult हो जाता है because you feel that it is normal. It is normal to break down during pregnancy. It is normal to feel blue during pregnancy. But it's not normal to break down daily during pregnancy. It is not normal to feel blue during pregnancy throughout for 2-3 weeks. अगर ऐसा हो रहा है तो it is not just a part and parcel of pregnancy. Something else is also happening, and that is not right, and that needs attention, that needs correction, that needs to be catered. Acceptance हमारे life में for हमारी society में depression and anxiety के लिए acceptance कम है. क्यों? Because we've grown up seeing our mothers, seeing women around us doing multitasking. When you're expecting, you try to pacify everybody. You try to become a perfect cook. You try to become a perfect working woman, wherein you feel that my pregnancy shouldn't be a reason for me not being able to do something correctly. This happens. We are constantly trying to prove a point कि भाई ऐसा तो कुछ नहीं है, ठीक है, I can do it के चक्कर में आप खुद को इतना stretch कर देते हो कि suddenly there comes a breaking point wherein you are exhausted proving yourself, you are exhausted doing and giving your best and being number one everywhere, be it house, be it work, be it with your your first child. You try to be best everywhere, and that is one thing जिसके कारण हम खुद को ये समय नहीं देते हैं कि नहीं, something is not right with me. You're constantly fighting to prove that नहीं, all is well, नहीं, it's just a phase. At times you just have to sit and think, is this just a phase or it is affecting my productivity? Is this just a phase or I'm actually not feeling right? इज दिस जस्ट अ फेज, और या मुझे इसके बारे में किसी से बात करना जरूरी है. टेक हेल्प, सीक हेल्प, डोंट टेक इट एज अ स्टिग्मा. आज तक कि मुझे ऐसा कभी नहीं हुआ, सो व्हाट, आज हो रहा है ना. टेक हेल्प, इट्स नथिंग, इट्स जस्ट अ फेज. आज तक के मुझे कभी ऐसा नहीं हुआ कि आई एम क्राइंग एंड आई एम नॉट फीलिंग गुड. मैं अभी तक के तो बहुत हैप्पी गो लकी थी. सो व्हाट, अब थे बट अभी नहीं हो, राइट. सो डू समथिंग अबाउट इट, टॉक टू समबडी अबाउट इट, टेक सॉल्यूशंस. जो हो गया सो हो गया, डोंट थिंक अबाउट इट, बट दिस इज व्हाट इट इज एंड फ्रॉम हियर you have to take it here, right? So respect what is coming your way and accept what is coming your way. Denial में मत रहिए, and don't try to prove a point everywhere. Don't try to overdo and be the best. I always say to all my expecting mothers, there is one word called pause. हम इतना दौड़ते हैं, हम सोचते हैं कि दिस इज माई सेकेंड बेबी, पर मेरे फर्स्ट बच्चे को ऐसा नहीं लगना चाहिए कि मैंने उसको जस्टिस नहीं किया, तो यू आउट डू फॉर दैट चाइल्ड. घर पे किसी को ऐसा नहीं लगना चाहिए दैट आई एम नॉट एबल टू डू माई वर्क, तो यू आउट डू इन योर हाउस होल्ड कोर्स. वर्क प्लेस यू फील दैट किसी को ऐसा नहीं लगना चाहिए जस्ट बिकॉज आई एम प्रेग्नेंट आई एम नॉट एफिशिएंट. यू आउट डू योर सेल्व्स एवरीवेयर. ओ माई डार्लिंग मदर, जस्ट सिट बैक एंड पॉज. Give yourself that time to enjoy what it is. Just don't keep on running. Just don't keep on running. Have this pause. ये pause बहुत ज़रूरी है. Take some time out for yourself, wherein you're just chilling out. You're just enjoying what is coming your way. तो फिर ये anxiety नहीं होगी. तो फिर ये जो symptoms बाद में आते हैं वो नहीं आएंगे. Because you have taken your pause. Because you have rejuvenated yourself. Because you have taken the necessary break which is needed as a person and जिसका हक बनता है, right? Am I right? So make sure that you're taking that breaks for yourself, and then and only then, whatever it is, even if you're facing some of these, make sure you're talking it out and finding solutions. Next question. There were some medical queries as well, but wherein I feel that for medical queries, you need to talk to your gynec and your doctor. Pregnancy is one of the most beautiful phases to all the expecting mothers. Right from the time you're seeing those 2 pink lines, affirm to yourself that I am going to make this journey as the most soulful and the most beautiful journey of my life. And this transformation will stay with you not only now, but in the time to come as well. Make sure you're eating well, you are doing something daily that you absolutely love to do. That can be listening music, that can be, dancing it out a bit, that can be meditation, that can be yoga, that can be eating your favorite food, that can be chit-chatting with your friends, it can be anything. बट दिन में एक बार डेली खुद के लिए एटलीस्ट हाफ एन आवर टाइम निकालिए, सो दैट दिस रोलर कोस्टर ऑफ इमोशंस एंड दीज थिंग्स डोंट कम एंड अफेक्ट यू. नॉनदलेस, अगर इनमें से आप कुछ भी फील करते हैं, फील फ्री टू टॉक टू द पीपल अराउंड यू, फील फ्री टू टॉक टू पीपल who actually care about you. Acknowledge your emotions, acknowledge your feelings, write them down, and talk to your consultant, seek help, come and let's talk. And there's one more thing which can be done. You can join and make some pregnancy groups wherein there are other expecting mothers and you are sharing each other's emotions, you're sharing each other's thoughts, you're sharing each other's journey. It makes it lighter, it makes it easier, it makes it happier. For example, if somebody is feeling blue, there'll be 10 other moms, to be moms, to pep her up, to talk with her, to listen to her. And at the same time, when some of these, when any of these might need help, there are others who can share their stories and their happinesses with each other. Make a routine to, talk to your baby. I always say that talking to your baby is one of the best things which you can do as a family. Not only you as an expecting mother, but your partner can talk to the baby. It's such a soulful experience and it's such a wonderful experience. And the best part of it is once the baby is out, the baby will recognize all the voices very nicely, and the connection and the bond would be very quicker and faster. The baby feels loved, the baby feels nurtured. Trust me, babies are very, very conscious. They are constantly absorbing आप उनको जो दे रहे हैं. So if you're giving positive thoughts, if you're giving that happiness, if you're sharing that love with that baby, तो उसको हमेशा एक wanted वाली feeling आएगी. For the babies, it is a proven thing, and research says that when you are, anxious during pregnancy, when you are not feeling good during pregnancy, आने वाला बच्चा जो होता है उसको एक unwanted feeling आती है, and these babies cry a lot after delivery. Whereas the baby जिसको आपने throughout 9 months nurture किया है, ढेर सारा प्यार दिया है, ढेर सारा टाइम उसके साथ अगर आपने स्पेंड किया है, तो these babies, they are more sorted, there is less of crying spells, and these babies grow up to be amazing individuals and human beings. Because just imagine, the feeling of being loved is the most important feeling which we as human beings can get. Once you get these feelings, you will never have breakdowns or meltdowns in your life. कभी भी अगर हम sad feel करते हैं, the moment you think that I have somebody who will share my pain, the sadness feels lighter automatically. The moment you feel worried, if you know that there is one person or there are few people who actually care about you, who will listen to you, who will be there for you no matter what, it will automatically feel, will make you feel lighter and happier. So make the most of it. अपनी pregnancy को खूबसूरत बनाइए, memorable बनाइए, because these 9 months will not come. वो जो rumbling, वो जो movement, वो जो kicking जो आप अभी feel कर रहे हैं, those feelings are surreal, and you'll miss when you hold your child in your hand. A heart is beating inside you, and when that heart beats outside, you'll actually miss the entire thing that was going inside. वो bond, वो connection पहले भी था, आगे भी रहेगा, but these moments will not come back again. So make the most of it. Make pregnancy the most beautiful journey ever, and make this as आपके लिए भी ये एक transformation होगा, because the positive things जो आपने in 9 months में अपने baby को सिखाई है, the positivity which you have infused will stay with you and will make you a better person, right? So my take home advice: eat well, sleep well, do your workouts, do your exercises, do your prenatal yogas, do your meditations, and share whatever is there in your mind, because बात करने से ही बात बनती है. Just keep your mind state positive, happy, for a healthy baby and for a healthy mommy. Because अगर आपका अभी का ये जो टाइम है, प्रेगनेंसी के दौरान का टाइम, अगर आप हैप्पीली एंड इन अ पॉजिटिव माइंड स्टेट निकालते हैं, तो पोस्ट नेटल डिप्रेशन के चांसेस नेग्लिजिबल हो जाते हैं. You will be at a distance from postnatal depression, because you know what is to be done when you are feeling certain things, what is to be done when you're not feeling right. Just cater your emotions, just speak them out, just seek help, just express yourself, and there you are, a happy, healthy mommy to be. Take care, and have a safe, healthy pregnancy. Feel free to connect anytime you want, and lots of love, and thank you. Thank you for listening.